Very welcome, everyone. The title of my PhD thesis is Investigating Alternative Methods in Caries Prevention. My name is Katinka Lékó-Kesjár. I work by the Department of Restorative Dentistry and Endodontics. My supervisors are János Vág and Esther Molnár, and my SMS is Sinitian. My vision is to create better oral health using alternative methods, and my mission is to explore new strategies in caries prevention. For the sake of this goal, I would like to present you my two ongoing projects. The first is investigating the effectiveness and safety of probiotics in preventing caries by using the methodology of systematic review and network analysis. And my second ongoing project is pretty similar, but instead of probiotics, natural and herbal oral care products will be in the center of attention. Let me tell you more about my first project. 2 billion people worldwide suffer from untreated caries of permanent dentition. If we leave a decay untreated, it will lead to severe complications. The best way to reduce this number is not to treat more caries lesions, but to prevent the formation of caries. The etiology of caries clearly describes that bacteria are essential for decay formation. If we intervene at this point by reducing the number of bacteria using antibacterial agents, then we can reduce successfully the increment of caries. Every fifth person sitting in this room, so 15–20% of the population, belong to the high caries risk category. For them, it's highly advised to rinse either with fluoride or with chlorhexidine mouthwash. These are effective and good, but have severe side effects. As we can see in the picture, this is dental fluorosis, caused by overusing fluoride at the very early age. Is the developmental disorder of animal. And 23% of the total population is affected by dental fluorosis. And our other gold standard is chlorhexidine, but as you can see in the picture, it has side effects as well that occurs even after 1 week of use. These side effects like taste change, tooth staining, sore mouth, or tongue irritation. And here comes probiotic in the picture as we are seeking for a new, very effective, but very safe alternative treatment. And probiotics have a long history of use without causing illness in people, and the possible indication field is very wide. It's very promising from food allergies through periodontal infection to halitosis, which urge us to set up the question. So our aim is to investigate if probiotics could be a safer alternative to chlorhexidine and fluoride in caries prevention. So the clinical question, can probiotics significantly reduce caries development? We would focus on general population, investigate probiotic in any form. We would compare it to fluoride, chlorhexidine, and standard of care, and the outcome would be caries increment, salivary streptococcus mutans count, and also plaque index, gingival index, and salivary pH. My hypothesis is probiotics are non-inferior compared to chlorhexidine or fluoride in the term of reducing caries development. Let me show you my search key. The first domain refers to all the arms in the network analysis, and the second domain refers to the outcomes. This search was conducted in 4 databases in the 8th of November. And I'd like to show you my key articles. All of them are randomized controlled trials and proving that all the arms will be covered in the network analysis. Let me show you more about my progress. The project was found to be feasible. The duplication removal was done in the 8th of November, and currently the title abstract selection is ongoing with my 2 co-authors, Dorottya Németh and Eszter Borbély. Let me show you the numbers. At the beginning, we found over 30,000 hits. After the duplication removal, over 80,000 hits remained. And the deadline of the title abstract selection is the end of December. Let me introduce you my second project, investigating the safety and effectiveness of natural herbal oral care products in caries development. 47% of people around the world have untreated decayed teeth. And oral disorders are as old as mankind. Even in ancient Greek time, a mixture of herbs, wine, and milk was used as a mouthwash. We're more lucky than that, as we have gold standard tools in our arms. But I already presented you the side effects of fluoride and chlorhexidine. So what's now? People are drawn for natural herbal products. They think them to be safer, free from chemicals, and better for their overall health. And the statistics shows that herbal medications are currently used by about 80% of the world's population, and the market for natural and organic oral care products is growing. So we have to set up the question, can herbal oral care products significantly reduce caries development? Again, the population would be general population. The intervention would be herbal oral care products with or without fluoride. We would compare it to gold standard or placebo, and the outcomes would be salivary streptococcus mutans, DMFT, plaque index, gingival index, and safety. My hypothesis is natural herbal oral care products are superior than standard of care related to caries development. I would like my summary, my two ongoing projects. Hopefully they will submit it by next year. And I would like to finish my presentation with my favorite quote from the Apollo 13 moon landing mission movie, "Failure is not an option." Thank you so much for your attention.
Thank you, Katinka, for your nice presentation. The discussion is open.
Thank you for your presentation. It was really nice, as always. I have two questions for you. The first one is that what forms of probiotics are you planning to investigate during your research?
Yeah, as I mentioned, we would investigate and include probiotics in any form. There are consumable form of probiotics, like they add it as an addition to milk or yogurt, or to make it more appealing for kids, they add it for ice cream or lollipop or cereals, for example. But there is a more conventional way of using probiotics, like in form of medications like powder that you have to mix. And also there is another form, then add it as an ingredient to a mouthwash or to a toothpaste. We would like to include all the types.
And are you planning to do subgroups with the forms of...
Yes, of course. After the data extraction, we will see what kind of subgroups can we create. It would be really beneficial to create subgroups based on the bacterial strains, but maybe we will not be able to do that because they usually use kind of mixtures. Maybe we can create subgroups by the way of consumption or usage.
Okay, thank you for your answers.
Thank you for this interesting presentation. I think using probiotics for prevention is impressive. I noticed that you mentioned that 23% Americans have too much fluoride in their teeth. Is that correct? And what could be the reason? Because I've heard or I read that they put fluoride in the drinking water.
Yeah, exactly.
What is your opinion on that?
Well, exactly. In some countries, they put fluoride in the drinking water, and I had the chance to visit the dentist in America, and I asked him how much is the fluoride concentration in the water, and he was not able to answer. And I tried to Google it, that on a specific county I was visiting, what's the exact level of fluoride in the tap water, and they were only able to estimate. But besides this, they have protocol, like you have to take your child to the dentist every 3 months, and they'll get a professional fluoride application. So that's why it's risky, because it adds up. If you only take your child every 3 months in Hungary, it should be okay and should be enough. But if there is fluoride in the water, it adds up and might be too much. And the very risky period is before 6 years old, because that's the time where permanent teeth are under development, and the fluoride can seriously influence the enamel formation.
But that sounds like they might be harmful for the patients.
Yeah.
Is there toxicity or something?
It can be. There are considerations somehow taking out the fluoride from the tap water. But I think what's most dangerous is that people where there is fluoride in the water, tap water, are not aware that they should cut back on fluoride in the toothpaste or not using any additional mouthwash.
I understand. Thank you for your answer.
Thank you for your question.
Next question is Abel.
Thank you for your presentation. Do you know any contraindications for probiotics?
Now it's said to be very safe and very well tolerated, but as every supplement, it can have mild side effects like problems in the digestive system when starting taking probiotics. And of course, there is a very low chance of bigger complications to occur, for example, bacteremia. But, for example, even for pregnant women, it's said to be safe to take dental probiotics.
Do you plan to discuss the safety in the project?
Diving deep in the literature, we didn't find enough data about the safety, so I will add up at the end of the paper. Hopefully I can add as an additional information, but there is no way to include it in the statistic because the lack of information.